name is Dr. Jillian Wong, and I'm an optometrist who regularly treats dry eyes with a technique called Meibomian gland expression. During last week's video, we discussed the Meibomian glands, which are the vertical glands that are in your eyelid that produce oil, which are important for your tear film to make sure that your tears don't evaporate too quickly, especially if you live in a very dry environment. Also, last video, we talked about the Chalazion and also the hordeolum, which is also known as a stye. So some of you may be wondering, what is the difference between a Chalazion and a hordeolum? The most important difference is that a stye is caused by an infection by bacteria, which typically means that the stye will be red and painful. Chalazion is actually just from a blockage in the oil gland, which means that it won't be painful but can become quite large until we can unblock the oil gland. Typically, we can get rid of Chalazion quite conservatively, using only hot compresses for 10 minutes and massaging your eyelid 4 times a day. Usually the hot compress needs to be as hot as you can stand so that it can melt the oil that's inside the eyelid, and then we need to massage it 4 times a day until it goes away. Usually, since the Chalazion is not caused by an infection, we typically don't need antibiotics, although in some cases we can use doxycycline at a low dose to help with the Meibomian gland dysfunction that could be causing the problem. Today, this video will be much longer than some of my previous videos. That's because these videos are taken over 4 sessions. So this person actually does have a Chalazion. So initially it was quite swollen. So here's me trying to look at the lid, and then it would just flip automatically. And then from the inside of the lid, you can really tell how swollen the lid is. So first step in the treatment is I did use my golf spud to debride some of the openings, just so that we can make sure that the openings are patent and that we can get the oil out. So here's me scraping open the lids. Occasionally in Meibomian gland dysfunction, there's something that can happen called hyperkeratinization, in which case the keratin will grow over the openings, closing them off. Next, here is me with the Collins forceps after anesthetizing the patient, and then here we are squeezing, and you can already tell that there are some oils that are coming out. Unfortunately, the Meibomian gland expression when the bump was so large was actually a bit difficult, just because it kind of kept slipping around the bump, and it was very difficult to squeeze. So sometimes we actually don't know where the oil is going to drain through. So we just continue squeezing, and then hopefully there will be one that will drain, and then we can kind of just continue on through there, and hopefully the gland will get unblocked. So for the most part, the video is pretty self-explanatory, but I'll interject if necessary. And finally, after many attempts, then we finally are squeezing, and then we actually do see quite a bit of liquid coming out of the Meibomian glands. There we go. So actually I was so surprised at how much liquid was coming out. So sometimes it's a little bit hard to see. You can kind of see it accumulating on the paddle. But that's the reason why it was so swollen, just so full of fluid. Also, another reason for this large Chalazion is likely that there's actually multiple glands that were involved, so multiple glands that were blocked. So another reason why this gland expression was so difficult is actually I needed both hands to do the expression. So that's my glove with the blue on the left, and then basically I needed to hold the lid so that it would stop flipping. And here we can see some of what was blocking the Meibomian gland. So there's that strand there of thickened oil. So this was actually probably one of the longest gland expressions that I've ever done. I forgot exactly how long it took, but probably over an hour of squeezing this one lid. We did have to use anesthetic multiple times for the patient, just because the anesthetic does wear off. And as a side note, this is actually before I got an IPL machine. If we had the IPL machine, that probably would have been a better treatment, maybe a little bit faster, instead of heating up with the hot pack to melt the oil. But we actually did get quite a bit of fluid. Otherwise, here is when I saw the patient 4 days later, and if we're flipping underneath to see a little bit better, it's actually way smaller compared to that first video I showed where the whole eyelid flipped and it was covering the entire eyelid. Also, something else to note is that after we do the squeezing, then we do flush the eye with artificial tears just so that we can get all that stuff out of the eye. Sometimes those things from the eyelid do contain some inflammatory particles, so we just want to get those out. Also, something else to note is that typically this would be considered a conservative way to treat a chalazion, and it can only be done when the chalazion is new. So pretty much if you left a chalazion for a long time, there might be some scar tissue that forms, in which case we can't get rid of the scar tissue just by doing an expression. So then we would have to send it out for a treatment by a lid surgeon, where they would probably have to cut open the lid. So for the second session, start off a little bit slow, but here we're squeezing, and you can just barely see there's something actually at the back, and then there it is. I think that could either be a Meibomian gland unblocking, although it could also be mucus that was behind the lid. So here we see some clear fluid coming out. There's one thick piece of meibum that just came out. Here's some more. Oh, and there's our big pop. So at the very end, just a little bit of blood. That's typically associated because of the pressure that we're applying. So nothing to be worried about unless there's a large amount of blood. So here's the final video from this session. So there's one final unblockage at the end there. So now that we know that the gland is open and we did get some expression, then hopefully the gland will now drain by itself. Although to help it along, then low-dose doxycycline actually can be used. So low-dose doxycycline is useful for when meibomian gland dysfunction isn't responding to typical therapy, which would be the hot compresses and the lid massage. Doxycycline technically is an antibiotic, but when it is used at low doses, then it actually is going to be prescribed for its anti-inflammatory effect instead of its antibacterial effect. So that would be great for meibomian gland dysfunction and Chalazion, which are caused by inflammation. But 1 week later, we'll see that the Chalazion is much smaller, and actually it has come to a point. So right on the first squeeze, and then we got that pop. So since we opened that opening at the back, then I noticed that there was a lot of fluid coming out from the back. So then I got a sterile cotton swab. So here I kind of wanted to soak up the fluid. Then I realized that actually it was draining just with us putting some pressure. So here I have both my hands, one holding the lid, the other one holding the cotton swab, kind of cleaning up the fluid. So sometimes it might go out of focus because I couldn't hold the microscope. So there is still some fluid, that's why I'm just dabbing with this cotton swab. I did see the patient 1 week later, and actually they were feeling much better and the Chalazion was gone. So no longer was it flipping over by itself, and then actually I couldn't feel any bump, which is the typical sign of a Chalazion. Thank you so much for watching. Please like and subscribe, and I'll see you at my next video.